Today we're talking about brain bypass surgery. Brain bypass surgery is not all that common, and typically when people think about bypass surgery, they think about bypass surgery for the heart. Well, neurosurgeons can do a very similar procedure to help bring blood flow up to the brain. Typically, we do this for people that have their carotid artery blocked. Most people have heard of the carotid artery, but just to review, the carotid artery comes up the neck and it actually goes up into the brain and feeds the brain with blood. There are many reasons why a carotid artery can be blocked. Typically it starts with a narrowing, but it can progress to total occlusion or blockage of that artery. Risk factors for this are the same as for heart attack: high blood pressure, smoking, and fatty diet. In this diagram that I've drawn here, this is the carotid artery coming up the patient's neck. At this point here, the carotid artery typically branches into two branches. The larger branch is the internal carotid artery. The smaller branch is the external carotid artery. The internal carotid artery usually goes up into the brain and fills the brain with blood, including this blood vessel on the surface of the brain. In this patient, the carotid artery is blocked. The reason the patient is not having a major stroke is the brain is very good at getting blood flow and typically can grab blood flow from other blood vessels, including the other side of the brain. Certain patients, however, cannot have enough blood flow going to that side of the brain, and they are at high risk for having stroke. In this situation, neurosurgeons like myself can use a branch of the external carotid artery that courses up the patient's head. We can actually make a very small incision on the head. We can cut this artery and then sew this artery to an artery on the surface of the brain. In more detail, that looks like this. If this is the artery on the surface of the brain, and this is the artery that used to be going to the patient's scalp, we cut this at an angle, we temporarily block this artery, we make a very fine opening in this artery and use suture about the size of a piece of a human hair, very, very small suture, to sew this vessel to this vessel so that in the end it looks like this. What that does is now, instead of going the usual route, because this route's blocked, the blood flow will come up the external carotid artery, go into this artery and feed the brain and bring the patient more blood flow. Bringing the patients more blood flow and getting the brain more blood will prevent stroke in the future.